Great. So if you guys feel free to go ahead and drop that in the chat. And we'll go ahead and get started. Um, so first thing I wanted to just share is that it is National Immunization Awareness Month. I've gone ahead and linked the CDC page, and this is a really good kind of resource page for everyone to kind of they have resources, they have graphics in English and in Spanish. They also have like some training things and some external links for healthcare professionals. And then also I saw some interactive it was like an interactive quiz to like let you know what immunizations you should have depending on if you're an adult or a child. So feel free to check out the link when I send out the slides, but it is from the CDC. So that is for the month of August. Great. And good to see everyone dropping names in the chat. We have a couple new people. So for the new people, welcome. If this is your first time joining us for these meetings, hopefully they will be useful. And we always record them. So if you can't join in the future, I always send out the slides as well as the recording. And then also upload the recording to our Your Membership page. And I'll talk about that a little bit later as well. All right. So I just also wanted to give a recap of the in-person meeting for anyone who wasn't able to attend. At that in-person meeting, we had a community outreach overview. So a lot of our community health workers now are working primarily under the community outreach grant. So the majority of you all should be aware of that grant. And if you have questions about it, feel free to reach out to me. I am the program manager for the community outreach grant. So I'm always here to answer questions, whether it's about reporting, what the scope of work that falls under community outreach, or what your organization has like agreed to do as part of this grant. So anything community outreach related, feel free to reach out to me. And also at the meeting, we had a social media best practices presentation by MPNF, which is our marketing firm that is developing our campaign. They are just really great at everything that they do. And so we were really excited to have them. We've done a couple of social media webinars, but there's, something different and really interesting with the social media platforms that they chose to talk about and the details that they shared with us about those. MPNF also did focus groups and to test the messaging campaign that we're trying to create. And I'm going to go over a little bit of the results that they shared. They sent us a more detailed memo. So we're going to go over that as well as the statewide survey. And then the last presentation that we had at the in-person was the CHW training panel with Christian from Vanderbilt, part of the Community Health Worker Training Program of Tennessee, and Beth, who does the apprenticeship path through Rural Health Association of Tennessee. Any questions about the in-person meeting, comments, feedback? Again, we really appreciated having everyone there who was able to participate. So yeah. Right. And then, like I mentioned today, I wanted to talk a little bit more about the statewide survey that took part through MPNF to kind of, that's what they used to kind of help develop these campaigns that were presented through the focus groups that the CHWs who were at the in-person meeting got to take a look at. And let's see. Oh, and then the link, I uploaded them to your membership. So let me first show you all how to get to the files that I uploaded through your membership. So your membership is a platform that TCCN uses to kind of share information, to kind of, it's kind of like, I feel like it's kind of like a social media platform because you can do discussion posts and you make a profile, but we also use it, and I primarily use it for the community health worker recordings and to share files. And so if you've never seen it, let me see if it will take me here and I can share my screen as well. This is my screen. I think this is, all right. So when you go to the TCCN page, you can click on the little logo at the top, and when you scroll down, there's going to be a login portal, and this is where you log into your membership. So my information is saved, and I had already had the page linked on the presentation, so it took me directly to the CHW resource page. But everyone should have a profile. If you haven't made a profile, you can make a profile. Within your profile, you'll have connections, groups. And so under groups is where we have a community health worker group. And this is where we can share pictures and updates. I uploaded some pictures from the in-person meeting there. I think we have about like 9 people that are part of the group. So we're always happy to have more people join. Um, and so on your profile, I think you can get it from your profile as well. So when you're on your profile, I think it has to be in the group. Oh, it's in the group. Yeah. So when you go to the group, you go to community health worker, and there's pages, and there's a CHW resource page. Within the CHW resource page, I've been uploading some of the resources, some of the links. So for example, there are graphics from AmeriCares. There's some in English, some in Spanish. And then also the MPNF resources, that the statewide survey, and then there is a PowerPoint, and then the detailed document that has it really broken down. And so we can look at the PowerPoint, since that's a little bit more a little bit easier to go through. And then we can also, and I've also uploaded the CHW focus group takeaways. And so that is the summary of the focus groups that happened at the in-person meeting. So let me stop sharing, and then I will open up the statewide survey. All right. So MPNF put together this really nice PowerPoint for us, and it just is a summary of the findings from that survey. So the survey took place from about April 20th to May 7th. Their sample size was about 700 participants. And again, this was to help develop the campaign and to understand kind of what the need is across the state. And to just overall people's willingness to get vaccinated and to better understand that. So as far as who responded, the largest response was in East Tennessee, followed by Middle, and then West. And one of the main questions was, what is your main reason for not getting the COVID-19 vaccine? And so the majority of the people responded, 69%, that it was safety concerns. Followed by, lack of government trust, they don't need it, personal reasons, misinformation, medical reasons. So this is a lot of the information, a lot of the things that we've heard from the people that we've talked to as far as, why they haven't gotten vaccinated. Another question was, how likely would each statement lead you to consider getting the COVID-19 vaccine? So this was kind of to get a better understanding of how persuasive people are, persuaded, I guess. And so, you know, the first statement, the COVID-19 vaccine has been in use for almost 3 years. A lot of these statements were not likely to persuade people, I guess. So that this was sorry. Um, yeah. So some of those key themes were, how long the vaccine has been in use, how effective it is, its longevity, how, thoroughly it's been researched. Um, so yeah, so these were some of those questions that were asked. And then trusted resources. So who are, the who are Tennesseans willing to trust? And 39, which is what the majority, said that they wouldn't trust anyone. So this was something that really stuck out to MPNF and to us as well. If there's a large majority of people that really don't trust anyone other than themselves, followed by healthcare providers. And so this is why one of the campaigns that was presented was, trust your doctor, your doctor knows best kind of thing. And so since that one was the next one, that was kind of why they highlighted that. We trust our healthcare providers, we trust medical professionals. And so they were the second choice. And then where do you get your information from? And so, a lot of people said that local, TV, radio, newspaper, also followed by digital. And so this was kind of to get a better understanding of where um, we would kind of spend our focus as far as like how we would promote this campaign. And then if anyone has any questions, feel free to jump in. I know this is a lot of information, and so I'm just like quickly going through it. And again, it's uploaded so that y'all can take a look and as well as the detailed analysis. And then this other question was really important. So, asking people if they get the flu shot, and the majority of people said no. So 83% said they don't, and only 16% said that they typically do. Um, and so kind of the summaries that they gave us was that the easiest people to kind of target would be that 16% that say that they do get a flu shot. So since they're willing to get some sort of vaccination, then they'd be more willing to possibly get the COVID-19. So that is kind of what they saw was the easiest starting point as far as persuade what population of Tennesseans to kind of persuade to get the COVID-19. And then focusing on messaging and vaccine safety, the single dose and research, as well as meet the people where they are with the voices that they trust. So this was kind of their summary of the statewide survey. Does anyone have any questions? And then personas by trusted sources. And so they kind of just broke this down for us by healthcare providers, government agencies, and family members. I see someone's hand raised. Marlene, Patricia, do you guys have a question?
It's not really a question, is that a lot of people don't understand that, we're having a new variant coming in. And we have seen maybe a couple people try to come here, um,
We're still
trying to
seeing
see, yeah,
positive cases.
trying to see if they can get tested for COVID because they've been around people that have it. Um, Last month, we did the COVID vaccines here for a few hours. We usually get up to maybe 5 to 8 people. Last month, we got zero.
Mm-hmm.
And it's hard to get these people vaccinated, and they're not understanding that we're getting this new variant, and we're seeing a lot of people get sick. The last week or so, we've seen about maybe 10 to 15 people come and ask to get tested. um they need to understand that just because um a lot of them, like you said, they're scared of misused information, and they just don't know what's in it. Or like in our clinic, 80% of our patients are Hispanic. Due to that, they feel like they'll be tracked by the government and things like that. And a lot of them also say that, they've had a lot of people die and things like that because of the vaccine. And it's been pretty hard lately. And I don't know if anybody else has another way for us to like engage with our patients, or what else we can say to them to be able to get vaccinated, which I know it's been 3 years, but I mean it's still going on.
Right. I definitely agree. It's still something that, with the new variants coming out, hopefully, and then, with the single dose coming
With the
out,
single dose coming out.
being able to kind of, share that information with people and let people know, what the latest is going on with COVID. And so hopefully as we develop our marketing campaign, we'll be able to have, information that kind of touches those points. There's still another strain, strains are still coming up, you still have vaccine options, where can you get vaccinated? And then hopefully MPNF will also be able to kind of do trainings with us on how to kind of talk about this marketing material that we're trying to present to people in a way that we can still relate to our communities, because you all are out in the community and you all know what your community members are saying and their hesitations, and being able to kind of link that together with this marketing campaign hopefully will be another way for people to kind of hear COVID in a different way. That we always hear people are tired of hearing about COVID, people are tired of hearing about getting vaccinated. But there's hope that this campaign will at least be new information to some people, and some people will be receptive to it. But thank you for sharing. Does anyone else have, any comments about, what Marlene is seeing in her community when it comes to like COVID and, this new strain, or people not wanting to get vaccinated? While you guys think about that, I'm going to pull up the MPNF detailed memo. So hopefully you guys can see my screen right now. This is the detailed analysis. So this kind of just breaks down everything that I quickly went through in the PowerPoint, and it gives the numbers by like region, what counties had the largest response, which obviously are the more populated counties like Shelby, Knox, Davidson. It has things broken down by race and ethnicity, um, like urban versus rural. And then they make note of the division between urban and rural. And this is kind of where they talk about, the trusted sources. And going into information sources, and that's where those numbers are, the reasons why people don't get vaccinated. And it has it divided by rural respondents versus urban. And then just each section kind of has a short summary with it. And yeah, so this is detailed. You guys feel free to look at this. And then again, overall key takeaways is kind of where they summarized everything. Yeah, this is the detailed analysis from MPNF for the statewide survey. And so again, this is linked in your membership page. So when I send out the slides, you guys would be able to access it using that link. Then again, if you don't have your membership profile, you can always make one. If you don't know how to make one, I have the steps, so I can also send that out to you all if you need help making your membership profile. And then I also wanted to share the CHW focus group takeaways. So let me open that. All right, so this is the summary that they sent us from the focus groups. So the 3 campaign ideas were volunteer to be healthy, take your best shot, ask a doctor, they get it. And so the rankings were that take your best shot received the most votes. So that was the campaign that it made me laugh when, people described it as very UFC, like boxing. And so it's like a little dark, and it had the 2 women that, had the boxing gloves on, and it was it was the most interesting graphic, at least to me. Um, that one received 17. The second ranked one was the Ask a Doctor, They Get It, and that was the one that had the blue question. It was like mostly blue, and it had a question mark on it. Um, and that one received 15 votes. And then the last place, the third place was volunteer to be healthy. This one was the one that looked like a Band-Aid in the shape of Tennessee, which surprisingly enough, when they first presented these concepts to TCCN, that was our favorite. We really liked the concept of it being Tennessee and volunteer. Um, and so that one was in third place within the focus groups. So some of the key takeaways that they kind of came up with for the vaccine booster shot, the consensus amongst participants is that they and their patients prefer the term shot rather than vaccine or booster. This is because the term vaccine and booster have negative connotations since they're associated with COVID-19. And these terms automatically bring up hesitancy and concern amongst certain populations. And then some languages that we would need to translate the material into would be Arabic, Spanish, Vietnamese, and certain African languages. And then material that would
Hey,
be most
Carmen.
beneficial. Mhm.
I'm sorry, it's Lindsay with Karis. For some reason, my chat isn't working, but also I'm having a really hard time hearing you. So I don't know if you can turn up your volume or something, but I'm really hard to hear you.
All right, I'll try to speak louder. Can everyone else hear me okay? Yeah. All right.
Yes.
Yes. Okay.
Okay, may
Also,
just be my app. Okay, sorry.
no, it's all right. I'll still try to speak a little bit more clearly that way. Hopefully you can still hear me. And so materials that would be useful included flyers, a banner, um, including the VAER system where you can report adverse reactions, QR codes, landing page outlines. So this is kind of all of the things that they heard would be useful to have as far as materials and part of the toolkit that we're trying to develop for you all. These were the likes and the dislikes and the suggestions for each concept. So for example, for the take your best shot, people really liked that it was eye-catching. Older patients are older women are, some of their patients, size of the text. So those were that it was catchy. Those were some of the things that were liked. Some things that weren't liked about it. It was hard to understand, does not move them to take action. The colors were kind of dark. It looked like a gym or fighting advertisement. And then creative suggestions. Mm, I feel like that one probably shouldn't be in this section about Band-Aid. That was the other one. And so then there's the suggestion section and the same thing for each concept. So what was liked about, the doctor campaign, what was disliked about it, and the creative suggestions. And the same thing for volunteer to be healthy. So that was all of the feedback that they received from you all and kind of just summarized it all up. Does anyone have any questions about the focus groups or kind of this summary that they sent us? And so kind of the next steps for MPNF was this focus group was the first of a series that they're going to be conducting just to get a better understanding of how people are going to respond to this marketing campaign that they're developing. And hopefully, I think they're going to do 3 or 4 more, and they're going to try to do one in the West Tennessee region, Middle, and East. So depending on where they're doing it, we're going to be reaching out to certain members, and certain member organizations are going to be hosting them. So you could be hearing about these focus groups again. And then again, we'll share the summary of that as well with you all, just because it's important for you all to be aware, to know, how this campaign development is progressing, since you all will be sharing this material within your communities. All right, we are almost out of time. Let me just quickly share, and you all can look through these once I send them out. So the 2 resources that I have for this meeting is the Public Health Foundation. They have a really good section on immunizations. Since it is Immunization Awareness Month, they kind of have put together some trainings, resources. They have like a list of webinars. Some are older, but they do have some that are new. And so just a variety of things if you want to look through that website. There was a lot of interesting things there. So I really do recommend looking at that one. CHW Awareness Week is coming up at the end of the month. So we're looking forward to being able to kind of highlight some of you all, the amazing work that you're doing. So hopefully y'all won't mind that we kind of, share your good work. But I did link the website for the National Association of Community Health Workers. I know several of our CHWs are currently at that conference this year. It's taking place, I think, today and tomorrow. So I know we're missing some people who are currently at that. But if you want to keep up, they have a newsletter that they're sending out as, Awareness Week approaches. I think it's August 28th through September something. So yeah, so we'll be sharing more information about that as well. And then the last thing that I wanted to just share was that we hear you guys really enjoy the in-person get-together. So we're gonna do one quarterly. So we'll do one in October, then we'll do one for somewhere in between January and March, and then for the last quarter, which is April to June. So for the next one in October, we have possible dates, which is either the 6th or the 20th. We were going to do a short poll, but I don't think we have time to do it today since it's already 10:30. So I'll probably send it out with my email, and then you all can just respond back, and then I'll just probably just add those up to see if anyone has like any conflicting events or anything for either October 6th or the 20th. It is going to be a Friday again. It'll be kind of like this last one. So yeah, so I'm excited that we're going to be able to do this quarterly for year 2 of community outreach. Does anyone have any questions? All right. Well, if you guys have any questions, feel free to send me a message or email me. I will be sending out the slides and the recording, and then just asking you guys again about, if anyone has any conflicting events for the 6th or the 20th. All right. Well, it was good to see everyone. I will see you guys 2 weeks from now. All right, everyone, have a happy Friday.
You too. Bye.
6 or 20th.